I want to thank you for giving me the opportunity to communicate what happens in Uganda. Right now, as I talk, I'm in the field responding to the Ebola task force, which I put the Ebola epidemic. Let me just remove my mask because I was in the field. I'm the case management coordinator for the Ebola task force in Uganda currently. And what we always do in Uganda is that we really cherish the involvement of the communities. And I want to thank the study which was really done to ensure that we involve the communities. Usually what we talk about is that epidemic starts in the community and it ends also in the communities. So the involvement of the communities are really important. So we need really to involve the community right from the start. In Uganda, usually when there's an epidemic, we have pillars which we commonly use to ensure that we respond to the epidemic promptly and within the area where the epidemic is. Currently, we have about 8 pillars which we are using, especially for the Ebola epidemic, which is in the country. The first one is the coordination, which looks at the finance and then how to bring the partners in line. The second one is the surveillance and epidemiology. The third is case management. The fourth is risk communication and community and involvement. The fifth is the logistics. The sixth is the IPC. The seventh is looking at the public relations. And then the fifth, the eighth, I'm forgetting. But each of these pillars, they have their responsibilities that they do, especially the risk communication and community engagement is so important that once we have them on the ground, they tell us what the community thinks. Sometimes the community don't want to report to our health facilities, but we ask the anthropologists working together with the risk communication, what is the problem? And this really inform the response, what we should really be doing. And sometimes people fear our isolation unit because they think when you get into the isolation unit, that's the end of you. So we make a lot of communication. We do a lot of teaching. And it is through this teaching that we can also do some training. We train people in the community. And once you train the people within the community, either as responders or people who are going to take the message home, that brings the community closer to the responders. Sometimes we have got some survivors, which when they come out of the treatment unit, they are like our mouthpiece. When they go to the community, now they begin telling the community what really happens. And sometimes they allay the fears, what many of the people in the communities are doing. But it is not very easy sometimes to enter into some communities because different peoples have different cultures. Some culture, they really honor the dead body so much. Some culture, when they're going to bury, they don't want other people to attend. And like us, for now that we are responding to the Ebola epidemic, all burials in the community, all burials from the health facilities are supposed to be conducted by the safe and dignified burial teams. So what we are doing is we have to emphasize that the community should really work with us. The community is a pillar. Is the community are the people who can lead where there are problems in any of the response. So when we think about beginning the planning for a response from below upwards is really important, because even when there is some suspect, when there is some issue that there may be an epidemic in a place, it is the community people who can blow the first whistle that you see in our place, maybe we are having a lot of deaths, people are falling sick, so many, what is wrong? And they can report to the health leadership, and health leadership can come and really respond very fast. And that may not be easily available to the surveillance team. And when they blow that whistle, that's when the surveillance team, be it an active or a passive one, can be put in place to ensure that the response can begin. The rapid response team can now go and investigate to see what is really happening, and then they inform the Ministry of Health on what should really be done. But otherwise, I'm not saying that the other pillars are not important. The other pillars are also important, but the responsibility of the risk communication and community engagement is really paramount in managing an epidemic that can occur in any country. Thank you so much. This is what I want to add to what has been discussed. Thank you.
Thank you very much.